When I first had the opportunity to work with hospice, I don't think I even knew what hospice was. My dad had been in the hospital several months before with serious illness, and I was there daily looking after him. And when he passed, there was this void. And when the opportunity arose for hospice, I felt like he had guided me there because I had never really been interested in medical social work. And then all of a sudden the opportunity presented itself. The hours were flexible, which worked very well for me because I was still looking after my mother in St. Louis. And the support from the organization has just been incredible. So it's been 18 years. I've gone from being as needed social worker, PRN, to part-time to full-time. And I can't imagine doing anything else. So what about you, Amy?
I think I chose Serenity HospiceCare because I came from a hospital setting and I didn't get all of the hands-on patient care that I wanted. It was a busy setting, and not that hospice isn't busy, but you get to take care of your patients. You get to take care of your patients' families. So I wanted that. I wanted to care more for my patients' hands-on experience, and I get that with hospice care.
I chose to stay with Serenity because it started off as a Christian organization and remained a Christian organization, and I really appreciate the opportunity to work with people as they are. As a chaplain, a lot of times people think that I'm a preacher, but I'm not. I'm there to walk alongside of them with no predetermined notions of what they should be, but who they are as a person and where they may be spiritually in their walk of life. It's important for me to walk with them and be an aid in their walk, not necessarily telling what they should do or how they should be, but to let them know they're not alone.
You know, I find that I have stayed because every time I walk in to meeting a new family, a new patient, they present fears. They're afraid of the diagnosis. They don't know what's coming down the road. And we offer them assurance that they're not alone, that they have the team there to walk with them through this difficult time. And it's amazing how open they are to accepting us at this difficult time in their lives. And they open their hearts to us, and we learn from them how to be open and caring, and we can take this lesson on to the next family that we work with. And so we're just constantly growing as a result of meeting these families, and it's very addictive to work with them and tell them, you're not alone, we're there for you 24/7. You never have to worry about anything, we'll be there for you, just give us a call.
What I want my patients to know and their families to know is that they can trust me. They can trust Serenity HospiceCare. That they can pick up the phone and dial our on-call service if it's after business hours, and know that they're still going to get somebody. Somebody's going to be there for them. And that, you know, if we need to come out and see them, we do that. And we can give them peace of mind. They need to know that every time that they need something, that we're going to be there for them. And we do that.
Yes.
And that's important to me. That's one of the big reasons that I love this company. That's excellence. That's what we have to have.
But not only can they call 24 hours a day and know that somebody's there, but they also know there's a whole team behind that, and they should know that with that they get the nurse and the social worker and the chaplain all there ready to meet them where they're at that moment, whatever their need is at the time, that the whole team is behind them. And not many places can they get a team just at a phone call.
Right. I completely agree, Rob. I don't think that I could do my job without the team, without the social worker, or without the chaplain. In order to take care of the patient, we have to work as the team, and we're all involved in to take care of that patient and taking care.
I think it's the coordinated effort of the team working for the benefit of the patient and the family that really makes it work. Right. You know, and that's one of the reasons that I just really appreciate working for Serenity.
What I want my patients and their families to know is that when I come into their home, they allow me into their home, that I am going to treat their mom, their grandma, their dad like they were one of my own, and care for them like I was caring for my own family. in everything that I do. I think that's what's so rewarding about my job, is that they're going to be so much more than just a patient to me. They're going to become my friend.
I think we can agree that we're exactly where we're supposed to be.
And I think it's a blessing where we are.